Well, hello, everyone. And I'm Patricia Raskin, and I'm excited about this new series that is being presented to you through the Lieutenant Governor's Office of Rhode Island. And it's called Positive Aging Rhode Island. And we will feature leaders in Rhode Island who are making a difference for older adults in our state. And I want to welcome Lieutenant Governor Sabina Matos and also Maria Cimini, who is the Director of the Rhode Island Office of Healthy Aging. Welcome both. Welcome Lieutenant Governor Sabina Matos and welcome Maria Cimini.
Thank
Thank
you,
you.
Patricia. Thank
Uh,
you.
Lieutenant Governor, let's talk about this project. I'm so excited that your office is supporting it and why you wanted to talk about positive aging in Rhode Island.
Yes, Patricia. So I've been listening to the work that you do, talking about positivity in general, and I'm a huge fan. And when we were together at an event and we started this conversation, and you mentioned about this possibility, I just love it right from the start because we need to talk about what are the positive things, what are the joys that we can find as we age, and what are the things that the alternatives that we have, where are the resources that can help us ensure that we are flourishing as we age here in the state of Rhode Island. So I couldn't say no to this opportunity. Thank you so much for bringing it. And I'm so glad that we're here and that our first guest is the director, Maria Cimini.
Yeah, wonderful. Thank you. Thank you for that introduction. Welcome, Director Cimini. And I love the title. I know the title changed. It's now the Office of Healthy Aging. And it's just such a positive, wonderful title. So tell us about the Office of Healthy Aging and some of the things that your team is doing.
Oh, thank you, Patricia. And thank you for having me today. Thank you for starting this conversation. And thank you, Lieutenant Governor Matos. You do incredible work in this space as the chair of the Long-Term Care Coordinating Council and just an everyday advocate for older Rhode Islanders. So, Patricia, you're right. I'm the director of the Office of Healthy Aging, which used to be known as the Department of Elderly Affairs. But think about that for a minute. What does elderly conjure in your brain?
Mhm.
And certainly there are people who think of themselves as elderly, but for most older adults, what they're thinking about is just that they are vibrant and still living their lives. It's not that they've transitioned to an elderly space. Their goal is to just keep living. And so that is our goal as well, to keep people engaged in community, to ensure that people are able to age as they want to be healthy as they do that, and to be sure that Rhode Island is a state that supports those desires and those wishes. And in fact, as the Office of Healthy Aging, in state law, my job is to be an advocate for older adults in Rhode Island to ensure that they age with dignity and respect in community as they wish to age. So everything we do at the Office of Healthy Aging is in support of that, whether it's answering questions from people about what to do in this new stage of life, whether it's about helping people to connect to resources, selecting a Medicare plan, identifying safety protocols, or one of the big things that our office does is that we provide resources to community centers, to senior centers, to organizations in every city and town to be sure that older adults are able in their neighborhoods around the corner from their faith institution, their pharmacy, their yoga studio to get supports that they are looking for and remain connected to other adults.
So it's not just for it's for all seniors of
Oh,
all
absolutely.
socioeconomic backgrounds, all needs. So it's not for just one population of seniors.
That's entirely true. In fact, like I'm kind of known for saying if you've met one older adult, you've met one older adult. And our job is to be sure that we are responding to every older adult. And that doesn't mean that every response is funded by the government or created by the government,
Mhm.
but it does mean is that are by calling the Office of Healthy Aging or by talking to staff at the Aging and Disability Resource Center, older adults from any walk of life, from any community in Rhode Island, someone who is an older adult at the age of 55 or at the age of 95, can talk to someone about what it is they want for themselves and what they are connected to would be driven by their ethnic background, their linguistic preferences, their income resources, their community that they want to live in. We're not going to refer someone who lives in Newport to a program in Woonsocket. It doesn't meet their needs. And so, and just like that, we are similarly approach every conversation from a person-centered spot to meet the needs and desires of that individual.
Yeah, that's great to hear. Yes.
And Patricia, I would like to add in here about the working relationship that my office has with the director's office. And I want to take this opportunity to thank you for your amazing staff because there are a couple of things that we're doing together. One is the everyday phone calls that we get from older adults that are looking for resources. We get questions about I have a family, there's an aging parent that I need accommodations. Where do I go? Any questions like that, we always reach out to the director's office, and they're very knowledgeable and helpful and help us assist the constituents. But something else that my office has been doing for about almost 2 years, as the director mentioned, I chair the Long-Term Care Coordinator Council. And this is a body that has about over 33 members. It's a meeting that is well attended in person, but also virtually. A lot of individuals always connect. A lot of resources, a lot of information gets shared in that meeting. But we noticed is that information was staying there among the same individuals that already have the network and the support. So what we started is bringing those conversations on those resources right into the different community centers, the senior centers throughout the state of Rhode Island. And the director's team is always there, always present, attending all of those sessions that we go. And we were very intentional. One of the things that I hear a lot is from communities that are away from the metro area. They said, no one comes here, no one brings us resources, right? So we were very intentional, and we started by bringing the resources to the senior center in Westerly, in Woonsocket. We went to Cumberland. We want to make sure that we bring the resources everywhere. And the director's team is always present and is always there. So thank you, director.
Yeah. And I think I'm so glad we're doing this because I'm not sure everybody realizes that. I think people think, well, I'm just going to call in if I have a problem, right? Or I can't find something. Whereas sometimes they can call in just if they want additional resources, or they might be moving to another part of the state, or they want to find a senior community, so a retirement community. So I think it's really good that we talk about this because in the new name, the Office of Healthy Aging, that's what you're talking about.
Mhm.
Seniors who are aging in all stages, and health is a focus.
That's entirely true. And while we certainly do get calls from people who have an urgent need, who are in crisis, either themselves as older adults or as the lieutenant governor shared, caregivers are often the people who call, sometimes children who might live in Colorado, but their parent is here in Rhode Island. They call and they say, I don't know what to do to help my parent who's there in Rhode Island. But planning is also an important piece of it, and we're always happy to answer the phone for that as well. It can be tricky because you can't plan for every possibility, but having a plan is so important. And that's a space where our staff at the Office of Healthy Aging, the team at the Aging and Disability Resource Center, known as the ADRC, and senior centers across the state are great resources for that to just,
Yeah.
especially I think at senior centers or at the community fairs that Lieutenant Governor is convening. places where you can just sit down, have a cup of coffee with someone, and talk about possibility, and that possibility may be like taking up a new hobby or
Exactly.
starting a new job or a
Mhm.
new volunteer opportunity. And also it may be, where do I want to live in a couple of years?
Yeah.
And what will I do if my caregiver is no longer available? And so having those conversations as a regular part of growing is really important. I think
Yeah.
sometimes about, I have young children, and it's very common that people will say, "What do you want to be when you grow up?" to my 10-year-old. But we stop asking those questions about dreams and
Mhm. Mhm.
about desires as we
Mhm.
age. But really, it's so critical to just normalize that.
Yeah, I love that. I think that's so important to talk about that. What are your dreams? We think, oh, we've reached a certain age, so we're just going to retire. And
That's right.
yet it's staying active and being
Hmm.
involved. That's what gives us the longevity, right? And the energy.
It's
So
so
it's
true.
great.
If I could just add one thing to that,
Yeah.
I learned so much as I'm out in the community, as we all do. And a couple of months ago, I was at Progreso Latino, and my Spanish is quite poor, but I make an effort on occasion. And I learned there at Progreso Latino that they encouraged me to use a phrase, tercera edad, which perhaps the lieutenant governor can pronounce better than I can. But tercera edad is like the third age of life. And so that's how they encouraged me to talk about healthy
Mhm.
aging in that
Mhm.
community. And it was such a wonderful concept to think about. It's a third stage, and those hopes that we have at younger ages are still there, and my job is to foster those conversations and connect people to those resources. And I think the lieutenant governor may correct my
Yeah.
Spanish now, which I would
Yeah.
Yeah, that
appreciate.
was good. La tercera edad is how we refer to it. And I have to say, it's just looking at life in a positive way and finding excitement as we age. I can tell you, not everybody does this, but when I turned 50 and I got my ARP card, I was happy.
Yeah.
I was like, I'm starting to get my discounts already.
And
We have to find the fun
yes,
and
absolutely.
ensure that
Yeah.
aging is not a bad thing, you know? It's just
Yeah.
we have learned the lessons that we have learned in life, and now we can live life with more purpose and more
Yeah.
excitement.
Yeah. And it's interesting when you say that because there is ageism in our culture. People look at, well, you're a certain age and they stop. But I'd love you to define, Director Cimini, some of your guiding principles that kind of speak to that, energy and life and longevity.
Certainly. So at the Office of Healthy Aging, we prioritize choice and a person-centered approach in everything that we do. I often talk about how every individual is unique, and that's kind of an accepted idea, right? We think of children are unique, everyone is unique, everyone has unique needs, and we think about that throughout the life course. But I think with older adults, it really is especially true because we're not talking about like a baby that has essentially the same experience of every other baby being born today. We're talking about a person who has 50, 60, 70, 80 years, 90 years of personal history that has
Right.
gotten them to that point.
Yeah.
So outside of the diversity that all of us have from our ethnic backgrounds, our religious institutions, our gender, our age, we also have that whole life history. And I think that that's what makes working with older adults so exciting. Sometimes an older adult who's is somebody who's 55 and they had a life of maybe a lot of manual labor and their body is feeling that now. And sometimes an older adult is 80 and running a marathon. And so
Right.
we at the Office of Healthy Aging,
Yeah.
that person-centered choice is what drives everything we do. We make no assumptions about the person who is calling us. They tell us their age, and certainly, we might have images in our head of because we know someone else of that age, but we listen to their story and what it is that they are looking for. Are they looking for a resource, maybe a medical intervention, because that's what they need? Are they looking for a connection because they're isolated. Maybe all their friends have moved to Florida. Maybe
Mm,
maybe they're looking
mm,
to connect with a younger
yeah.
generation and bolster through their wisdom and their learning to support the next
Mm,
generation coming up. So
mm,
our top priority is, or our top goal is about ensuring that choice is available and
mm.
listening and offering a compassionate ear as we hear people's stories, because we also recognize that a lot of people call us expecting the ageism that they hear in other places.
Yes,
And so
yes,
we also want to be a counter to that. And that doesn't mean that there aren't older adults with mobility issues, just as there are younger people with mobility
right,
issues. The
right,
goal is to meet that person where they are.
right. What do you see as the biggest barrier that facing older adults who want to age in place? Is it ageism? Is it mobility? Is it lack of resources, lack of knowledge? What do you think?
Well, I think it's really multifaceted. I think that on an individual level, I think that there is, because of ageism, I think that there's anxiety about having conversations. I hear oftentimes that people say they're afraid to tell their child that they've fallen because they're afraid their child's going to put them in a nursing home. And
Mm,
that is
mm,
such that's such an ageist component, right? Like that we
mm,
assume if I fall
yeah,
down, nobody thinks twice about it. But if my mom falls down, people would be
mm,
concerned that she's no
yeah,
longer able to live
yeah,
in a healthy way alone. So there's that kind of piece that is an ageist society and an ableist society that we need to be countering that narrative, which I think that you do so well with your focus on positivity.
mm,
When we are afraid to have conversations, then no one is going to be successful in their aging.
yeah,
Then there are clearly some systemic issues that are broader. We know that we have housing needs in the state of Rhode Island. That's not something that an individual can solve by themselves. We have people who are in houses that are bigger than what they want to be in or need to be in, and they don't have an appropriate place to downsize to. Or people who want to live in community with other older adults or need extra support, and being able to find those resources that are accessible, affordable to that individual, not necessarily low income, but just affordable. Everyone has some kind of budget and available where you want to be. That is a real challenge. And
yeah,
so I think that to me, on an individual level, people, one of the greatest challenges is just people's feeling safe in their relationships to have conversations about what it means to age and address that ageism head on. And from a society level, we have some infrastructure challenges that we need to address.
Yeah, and I want to add to the infrastructure. I think housing is one of the biggest challenges right now that individuals are facing. And I can tell you based on the number of phone calls that my office gets from seniors that are looking for home to live, or they're asking me for apartments. They want to fill out an application in this high rise or this other one. So that is a big challenge. The other challenge right now is there are individuals that wants they to be by themselves, but sometimes they don't have the support of the network of the family around. And I can give you a good example. My grandmother actually, she's gonna be 102, right?
God
wow,
bless
But she
wow,
lives on her own apartment on the
wow.
same building as my mother. She's on the first floor. My mother's on the second floor. She wants that independence, right? But she's very fortunate to be able to count with support. She has 12 kids, right? So
12
she's
children
all,
and 102.
that's right.
What's her secret? I want to know what her
Uh,
secret is.
I think she's a happiness. I always looking for the positive things on everything. I think that would be
Mhm.
her secret.
Yeah.
And I can tell you, she enjoys having her independence, right? With the family that are always around. So now family's always someone is with her, but she loves that opportunity to be able to be in her own space and her own apartment and
Yeah.
not feeling like she's living on somebody else's
Yeah.
house, right? And I think that contributes a lot to her longevity and in her happiness to be able to be in her own space, but always surrounded by family. Unfortunately, not everyone has that
Yeah.
type of support and resources. And that's when groups and organizations like the Village Commons come into place to help our aging adults to be able to find support and to be able to live on their own.
Yeah. Yeah, I mean, that's just so important. I feel as an early baby boomer, I want my relationships and the connections, but also that feeling of independence, that I have a space that I can go to that's mine. And I think that makes it just so important. One of the things I wanted to bring up that I was part of, that it really speaks to community and to discussions and conversations, is Leadership Rhode Island created the Senior Fellows Program along with Age Friendly Rhode Island. And I think I was the second cohort a couple of years ago. It's a wonderful program because you apply and they choose people, I believe it's over 60 or 65, and we all get together and we talk about what are the resources in the community and what is ageism? How do we combat ageism? And we bring in people from different organizations like the Office of Healthy Aging or Meals on Wheels. And so it's been wonderful. And every year they have a new class and new graduate of class. But it's a wonderful program in Rhode Island that I wanted to bring up that I think is so important for seniors. Yeah. Any comments on that?
Yeah, actually, I love that program. I saw you when I believe when you guys came to the State House with that program, I
Yes.
believe. And also, one of the class did a project that was presented to the Alzheimer's
Isn't that great?
committee.
Yes.
So I love that program. Actually, one
Yeah.
of the members is still active with the Alzheimer committee. We just had the
Yeah.
meeting yesterday. He
Yeah.
was there.
Yeah.
So I love that program. I'm so glad that Leadership Rhode Island took that initiative.
It's
Yeah.
Yes. And
also
I just wanted to
I was
add,
just going to say it's such a great example of what we spoke about earlier about continuing to have dreams and goals into different stages of life. And
yeah,
Leadership Rhode Island
yeah,
really embraced that idea. And as the Lieutenant Governor said, the Village Common of Rhode Island is another opportunity for people to engage in that way. Age Friendly Rhode Island is in that space quite a bit. As more communities become age friendly municipalities or age friendly cities, there's more opportunity for that. So
yeah.
there's really a lot of possibility for connection. And one of the goals that we have is to just make sure people know about those things. And hopefully this opportunity of Positive Aging Rhode Island will bring more awareness of so many of those great programs to older adults throughout the state.
Yeah, thank you. And I also want to add, yes, they're at the Seniors Fellows Program, which is part of the Leadership Rhode Island. That program, all of us had to have a project, everyone. So now you have 25 people that have to reach out to one of the state agencies and do a project. And that just spreads the word even more and makes such a difference. So there's such an active community, which is wonderful. Um, Director Cimini, what policy reforms are you most hoping to see Rhode Island embrace for the future of healthy aging in our state?
That's it's such a great question and can go in so many different directions. So, Rhode Island, as I believe I said earlier, is fast aging. We're one of 11 states where we have more people over the age of 65 than under the age of 18. That was released by the census just this past summer. And the largest age cohort of Rhode Islanders are 60 to 64-year olds. So there are a whole host of things that we're doing as a state to plan for that. And there's a lot of attention on older adults for that reason. So, just kind of thinking about it, Governor McKee has an affordability for all goals in his budget, and one of those goals, I'm going to actually just speak about some really specific policies, if that's okay.
Sure.
One of his goals is to eliminate the Social Security tax for those in the first year for those individuals who retired between 62 and 67, which I think is such a powerful opportunity for older Rhode Islanders because we we years ago eliminated the Social Security tax for many older adults who retired after 67, up to a certain income threshold. But those who retired between 62 and 67 were not able to, we did not exempt their tax. And oftentimes, the people who retire earlier are those people who need to. Maybe they've worked very physical jobs, physically demanding jobs. Maybe they need to be a caregiver for someone else. And so, those individuals who oftentimes actually have fewer financial resources ended up having to pay additional taxes that their counterparts who were able to wait until 67 to retire don't have to pay. So that's a present day policy that I really hope moves forward this year. Similarly, Representative Carson from the Newport area has been convening a commission for almost 2 years now, looking at older adults in Rhode Island and how we can better serve and support them. And she has a piece of legislation right now that I think connects back to how you started this all off. Let's clean up some language. Let's look at how our language impacts our thoughts of individuals. So she has a proposal to change within our state statutes, remove the word elderly as much as possible and replace it with older adult, which provides a respect and disrupts the thought process people have about older individuals. Representative Boylan has a bill right now to allow for foot care in the home, which it sounds so small and so niche, but is such a quality of life issue for older adults who need to be able to have foot care done, especially those individuals who have diabetes or other chronic diseases who aren't able to get to doctors. And right now, we don't have a path to those individuals getting help in home. And that's like something small like that, having foot care in your home could be the difference between being able to stay in community or going to a nursing home. So those are some very specific things, but I'll say that Rhode Island as a whole is really looking from separate from a kind of policy like laws to pass. There really is a lot of discussion about making Rhode Island an age-friendly state. And age-friendly communities are an accreditation or a stamp of approval from AARP, and there are several cities in Rhode Island who have pursued that. And we're really looking into investigating the opportunity to make Rhode Island age-friendly as a state, which would come with policies, but more than policies, just everyday integration forefront of our mind. Be sure that everyone can participate in all that is great in Rhode Island. And so that's always a lens that I look at policy issues through.
Yeah.
And I want to take this opportunity to put a plug for a legislation that my office introduced that has to do with the business community. Those in the business community that are thinking about retirement within the next 5, 10, 15 years and suspecting that it's going to be such a huge transfer of wealth happening in this nation because many of the baby boomers are thinking about retirement. COVID had also a lot to do with this. A lot of people are decided to rethink how they want to spend their third generation, right? And so many of them are thinking about retirement. And what we have found is that the business owners, the data have shown, they don't want their kids to take over the business, or their kids don't want to take over the business. Yeah. So we have a legislation right now to create a center for employee ownership to help those small business owners that are thinking about retirement to make sure that they're able to get for their business a payment that is worth of the sacrifices that they have invested in that company, but also to help them sell the business to their employees to ensure that we preserve the legacy. Because we had found that for business owners, the small business owners, preserving the legacy and all the work that they did is very important. Yeah. So we have that legislation also at the State House right now.
That's wonderful to hear, particularly for those of us who are small business owners who spent, as you said, years and years of dedication, doing our work to make it happen. So what this is a question for both of you. What can community members do to better support our older neighbors? I mean, you've talked about lots of the resources, and I know that we can give the website for the Office of Healthy Aging and the numbers, but what can community members do? Director Cimini.
Certainly. I think that I want to start with the most informal thing. Most people live next door to someone else. We need to just be willing to maybe take a deep breath and ring a doorbell and say hello and know our neighbors. That is something that feels like it's gotten lost over I don't know how long, and I don't know the reason why, but it does feel like we've lost something there. So if you live in a neighborhood where you know your neighbors, that's excellent. And if you don't, then like take the deep breath and knock on the door, because we're not going to support each other if we don't know each other. So from the small, like the lightest touch level, which might be the scariest, know the people who live around you. And then there are some more formal structures. We can join the Village Common, which is an organization that matches older adults with other older adults to provide companionship and activity and support to one another. It's a community-based program, and they're growing all over the state. Go to your local senior center, ask if you can volunteer. Go to your local library, go to your faith institution, visit an assisted living facility, call your grandmother. Like all of those things are things that everyone is able to do.
Yeah.
And it's
Yeah.
true whether you're a person who has no mobility challenges and go out and about and you're comfortable driving at night. And it's true if you're a person who's essentially homebound, but you have a telephone, and there's opportunity for everyone to form connection with someone else. And I think one of the most interesting things I've learned in the last few years is when the CDC, the Center for Disease Control, said that social isolation is as physically harmful as
Yes.
smoking a pack of cigarettes a
Yes.
day. Like
Yeah.
it blew my mind.
Yeah.
And so this idea of how can we support one another, thankfully, is incredibly available and incredibly easy if we just make the time to be in community with one another.
That's so beautifully said. And so true. I mean, connection is one of the most important things. And just reaching out. Many times people do this during blizzards, like during the blizzard. We got to meet people that we didn't even know. And does it have to be during those times, right? It can be during normal times when we don't have crisis. So
And that
crisis can bring
actually,
opportunity. Go ahead.
yeah, that actually was going to be also my feedback on this part is it's so important that we check in on our neighbors, just like as Director Cimini was saying. In you mentioned the storm that we just had, the blizzard, and I think there was a little bit of a blessing in the middle of all of this because neighbors got to meet their neighbors. I can tell you,
Yeah.
my parents, right, that are 75 and 85 came out to the street to clean out the snow together with the neighbors, right? That was an opportunity for them to interact. But one of the things that breaks my heart the most is when I hear news about a senior person that passed here or throughout the country, and that for days no one knew, you know? So
Mm,
it's just that really breaks my heart.
yeah.
And I think if you know that there is an older adult in your community, just check in. If you don't see them come and take out the trash or put out the trash, go and knock at the door. Ask if
Right.
everything is okay. Ask if they need anything. Because you never know. You could be the person saving that individual that day.
Yeah, so true. It's so wonderful Rhode Island's doing. I'm so happy that I'm here in this state, but it's really wonderful. And I think as a boomer, I mean, I just keep moving the way I moved 20 years ago. Right now, it's true. We may not, hear as well or walk as fast. We may be a little slower, but we're still doing all the same things. And as you've both said, we have the wisdom, right? We have the wisdom of the years and the knowledge. I'm very fortunate. Talk about intergenerational activities. I work with college interns from University of Rhode Island, and I've been doing that for 10 years. And the downside is you only have them for a semester. but the upside is I meet these incredible young people. And it's really an intergenerational thing because they're so incredible with social media and with technology. They're like little wizards. They pick it up in one day, right? It would take me like 2 days. And yet I impart my knowledge about the media business or about interviewing or about newsletters. So it's a wonderful partnership, and it has kept me vibrant. And it's just really a wonderful thing. So thank you for all the work you're doing. Any closing thoughts or resources you'd like to leave our listeners with, Director Cimini?
Thank you so much. I cannot let an opportunity pass without sharing two phone numbers that I think are critical for every Rhode Islander to know. First, one of the most important things we do at the Office of Healthy Aging is that we investigate elder abuse or self-neglect. So if you are concerned about someone in Rhode Island over the age of 60, I always want people to know that they can call 401-462-0555. And by making that call, and it's not saying someone is being abused, it's saying you're concerned, someone from our office goes out and knocks on that door and checks in on someone. It's entirely confidential. And then the other phone number I always like to give is for the Aging and Disability Resource Center, which I've referenced a few times. That number is 401-462-4444. And at the Aging and Disability Resource Center, people who are trained to know the resources around aging in Rhode Island, but even more so, are trained in something called person-centered options counseling. They're trained to have conversations, to listen, to understand what someone's desires are and help point them in the right direction. And that is the first call that any older Rhode Islander or loved one of an older Rhode Islander should call if they are just trying to figure out what to do next. And that could be next as in, what's a fun thing I could engage with, or next as in, how do I figure out nursing home care? It's the whole spectrum. Thank you
Yeah.
so much for the opportunity.
Oh, this is wonderful. Thank you. Closing thoughts, Lieutenant Governor
Yes,
Matos.
thank you. So there's a couple of resources that I want people to be aware. And director normally has one, but I don't have it next with me. And it's your little guide that you have for resources. I know I have it right inside of my office. Make sure you get one of those. Those are available, all the resources that the director
Wonderful.
put together and her team for our aging population. But a resource that everywhere I go and mention is just dialing the 988 number. If you are feeling lonely, if you're worried because one of your family members, because we have found that elderly, the aging population here in the state of Rhode Island tend to take in all the care and the worries for their kids, their grandkids. If you have concern about family members that are struggling with mental health, please call the 988 and you're going to find resources that are going to help you. So just remember to dial that number if you're feeling lonely, if you're feeling depressed, if any suicidal thoughts or you're family members, just dial 988.
Thank you. Thank you both, Maria Cimini and Lieutenant Governor Sabina Matos, for an inspirational interview. Thank you both for your dedication, your caring, your belief in all of us who are aging older adults, and also the opportunities that you're offering for the residents of Rhode Island. So everyone watching, please take advantage of this, follow the numbers, and call the Office of Healthy Aging. And if you need anything, there's the Long-Term Care Coordinating Council that Lieutenant Governor Sabina Matos oversees. So certainly reach out. The resources are there for you in the state, and I'm very happy to be part of it. So this was actually our first episode of Positive Aging Rhode Island, and again, brought to you on behalf of the Lieutenant Governor's Office of the state of Rhode Island. Thank you so much. I'm Patricia Raskin. Been great to be with all of you today, and see you next time. Bye for now. Thank you both.
Bye. Thank you, Patricia.
Thank you.